Hey everybody, Dr. Matt Maggio here, founder of Soft Tissue Practice Revolution. The other day we did a video about Hip 101, talking about different types of diagnoses, problems that you can see in the hip, some common diagnoses that are wrong. What we wanted to show today was an actual functional evaluation we do to assess hip mobility, functionality, and really try to rule out if those other pathologies are in there. So the test that we do here is you're going to have the client or the patient lay flat on the table, just like this, and we're going to check the left hip on this person. So basically it's laying down on their back, and we're going to test what's called hip flexion. So the first thing that I do is just kind of let the person know what I'm doing. So what we're going to be doing is testing the overall function of your hip and seeing how it moves, and you're going to let me know what you feel with anything like that. So the key is you want to do 2 reps. The first one is you're just going to do it so the patient has it, then you're going to ask them what they feel and everything like that. Then on the next one, you're going to do a measurement, because measurements are very important. If we have a measurable component, we have real results that we can give to the patient and go from there. So this test, what you're going to do is very simply, you're going to bring this hip and leg up just like this to 90 degrees, and you're going to watch this leg and make sure that it stays down. And what I do is I put one hand back here behind the knee in the popliteal fossa, and what I want to do is I want to bring this straight back towards the chest. And what we're trying to do is see how easily this quad can go up here and touch the ribs. A full test should be the quad touching the ribs nice and easy without that hip hiking up. So we're going to bring this up nice and slow just so the patient can feel that. So now you kind of get an idea of what that range feels like in your own idea. So I just kind of play around with it and see if it gets like a hard type of feel. So now I'm going to do it again. I'm watching that hip, and I'm going to bring it as far as I can go. And I'm starting to get some resistance, so I will lean on it a little bit because it can go a little bit. And then I'm going to ask the client, what do you feel with that?
I feel tension in the front of the hip.
Tension in the front of the hip, is that mild, moderate, or severe?
Mild to moderate.
Mild to moderate. So you always want to collect data in there. You don't want to just do a test just to do it. So now I have that in here. So the next thing is we're going to bring this back, and we're going to get a measurement. So you can see here, she has full range of motion, but they're still getting symptoms in there. And when I get them to the end range there, I will give it a little extra and see, does that increase your symptoms?
Yeah.
Okay, so now we got some data on there. So normally what we do is we bring this up here, and someone that has some pathology, specifically degeneration, hip problem, cam, pincer lesion, this is going to be limited. You're going to see a hip hike in there, and they're going to get some pain. So the next thing we do is we check for the measurement. We see how many fingers restrictions there is. So every finger that goes, it's about 10% restriction, give or take. So if she was here, it would be, come zoom in a little bit for me. If she's here, this would be a 4-finger restriction, and that would put that at 60%. Here would be 3 fingers, 2 fingers, 1 finger. So in here, she actually has a full range of motion, but she's having symptoms. So the symptoms still tell us that there's an issue in there. I would do the same thing on the other side. The key with a functional evaluation is you're going to get a lot of data. You're not just going to do it just because. You're going to be collecting a lot of data. So in this situation, come back and over for me. So in this situation, she was complaining of like a deep type of pinch in through here. And this area in here is going to be very common for that type of cam/pincer lesion, and also a labrum type of degeneration as well. You're usually going to see this in a younger population anyway. People, I'd say 45 and younger. When they're above 40 and older, you're going to get that degeneration where it just kind of stops in there as well. So that's a big component of that as well. But you really want to ask them what they feel and how and where they feel it. Sometimes you'll get some pain out in the lateral portion of the hip and some discomfort in there. A lot of times that's just some swelling of that bursa sac. It's technically bursitis, but that doesn't give us the idea of what's going on. So essentially in this test, we're checking 3 things. We're checking the overall mobility of the hip joint itself. We're also checking the lengthening of the adductor magnus, and we're also seeing how this posterior hip capsule moves going through there. So functional tests are very important because they give us a window into what's going on so we can interpret the data. So taking a very thorough history, now things start to go together. And having this actual functional range, you can have a pre and a post-test to see how they're doing, especially if you apply treatment. If you apply treatment, you should see a result right away, and then you should actually see that that result goes after a few days when they come back. So that's the difference. Having a long-lasting type of change is a big difference. So in our next video, we're actually going to show how I would treat the adductor magnus muscle, how I do palpation, how I do everything like that. In order to see that one, you got to join our Facebook group. I have a closed Facebook group for practitioners only, and basically to join the group, you just click the link in the bio and go through that. Once you get in there, we take you through a certification process just to see if you are. You have to provide that you do have an active license and things like that, because we are not going to demonstrate treatment for people that aren't licensed to do what they need to do. So if you like the video, you like what you see, drop a comment, like, or share. And if you need any help or you have any questions, follow us and send us a message. Thanks for watching.